All right, gang, here's our next video. We are going to continue to explore connective tissue, and we're going to look at the ligaments and tendons. So I am going to share my screen, and here we go. So when we talk about, we're going to talk about first ligaments, and then we'll look at tendons. So ligaments are dense collagenous tissue that has little innervation or blood supply. So they're just like we were talking about with our articular cartilage, right? So they have collagen in them. So these are really thick, fibrous pieces of material. And the function that ligaments play in our body is to connect bone to bone. And that connection between bone to bone provides stability and movement. And they are actually not meant to be stretched. So you maybe have heard of people twisting their ankle or tearing their ligaments in their knee. And that's what they're referring to is these ligaments get torn and stretched. And that's not what they're there for. They're actually there to create stability and to be able to allow for movement in certain planes. So we're going to go into our back into our anatomy app and take a look here. So you probably may realize or may not realize that you are already familiar with ligaments. Their most common place to look at ligaments is in the knee. So we're back in our knee here where we were before, remember? So I'm going to just turn this guy around. So here's the articular cartilage at the base of the femur. And then here's our articular cartilage on the top, the anterior portion of the tibia. And then here was our fibrocartilage, the menisci or meniscus here, this medial meniscus on this side. So now we're going to look at ligaments. So it's a little harder here. So I'm going to zoom in for us, scoot it over. And this right here, so we're looking at the medial side of the knee. So here, this is sort of a medial posterior view. So this is the back side of the knee joint. And then here is the inside of the left knee. And this green highlighted ligament here is what we call the tibial collateral ligament. It's also commonly referred as the MCL. So that's how I know it, medial collateral ligament. And this runs from this portion of the femur down to this portion of the tibia. Now, these connections where this ligaments starts or originates and then inserts, these actually have names, but we're not going to worry about naming these processes on the bones, but just know that there are names to identify where they start and where they insert. And so you can see you can almost see as we get a little bit closer, and I'll unhighlight it here. You can see sort of these striations through here. So this is a really thick collagenous tissue. And there isn't, like I said, a lot of innervation from nerve or blood supply. So when you damage these ligaments, it can be really hard to actually get them to repair and go back to where they were before. And oftentimes in the knee, this is one of the more common sports injuries as people will have an MCL tear. So they'll be hit from the lateral side of the knee. So they'll take a hit from this side or they'll plant incorrectly. And then what will happen is those forces will force the femur and tibia to break apart. So if my hand's here, this is the femur and this is the tibia. And then my thumb is the medial collateral ligament here, the MCL. And you get hit from this side and it pops this ligament apart. Oftentimes you have to have surgical repair. The other one you may be familiar with is this guy that sits sort of on the inside. It's called the anterior cruciate ligament, the ACL. So oftentimes the MCL and the ACL are injured at the same time if they're injured. It's a little, we'll see if we can break it apart here and take a look at. It's kind of hard. Yeah, it's hard with the patella in the way, but you can see, I can zoom in here. So here it starts here at the anterior portion of the tibia, and then as we circle around, it runs back and up through to this upper portion of the femur here. So this is called the ACL. And there's actually another one that runs back here called the posterior, the PCL back here as well, but we don't have that up. And then we'll just take a peek at the other ligament in the knee, which actually runs over. We're going to look at this here in the next couple of videos. This is the joint capsule, but here is what we call the LCL, or it's also known as the fibular collateral ligament. So we'll turn that a little bit here. And you can see it's not as long as the MCL. It's a little bit shorter because it's connecting in a different fashion. It connects from the femur down to the fibula, the smaller of the two bones in the lower leg. Good. Now, the other ligaments I want you to look at. Now, you really won't have to remember any more than that. And then what we're going to do, we're going to come up towards the pelvis, and we're going to look here. So the other area where I think ligaments are really important, well, they're important everywhere that they are, to be honest, but ones that you may hear about when we talk about teaching in yoga, or people will come in with injuries or things going on with their knee or going on with their hips or their sacrum. So we're interested in looking at, just very briefly, the sacroiliac ligaments. So again, you don't have to know the bones just yet. We're going to review them, but know that down here, so this is, let me just highlight this guy. So here is the base of the spine. This is the sacrum. This is 5 fused bones, and we'll go over that in the next couple of videos. And the sacrum sits in between the hip bones. So if I can highlight that here, this is part of the hip bone here that's called the ilium. So there is a joint that happens, we'll turn them around, between the ilium and the sacrum, and it's called the sacroiliac joint. And again, we'll review this here so you don't have to worry about remembering that right now. And so in order to keep this joint stable, between here and here, the sacroiliac, or the SI joint, what the body has done is it's laid down these ligaments. So here is the anterior sacroiliac ligament, and you can see it's a pretty big ligament. It's this really thick, fibrous, wide band that covers the anterior portion of the SI joint. And then we'll flip our skeleton around, and we'll take a peek here at the back side. So then we have this one here, and this one is called the posterior sacroiliac joint, or sorry, iliac ligament. And here, and then you have this guy, which is the interosseous sacroiliac ligament. Now, you don't have to remember these individually, but what I wanted to point out is that there are several ligaments that help to stabilize and balance the sacrum into the pelvis. So this is where our spine connects to the lower half of the body. And these ligaments are really important in our stability here. Perfect. So now we're going to go back to, just bring this back here, and we're going to get this screen pulled up. And we're going to check out what the tendons are. Maybe I am. Well, there it is. Okay. So let's go back to our sheet here. And I've got pictures for you guys to be able to reference. So here's the MCL, the LCL, the ACL, and then our anterior interosseous and posterior SI ligaments, just for you to reference. Now, we're going to come down here and we're talking about tendons next. So tendons, similar, very similar to ligaments, only what their function is to connect muscle to bone. So as the muscle starts to taper on either end, what happens is those fibers of the muscle start to thicken, and they essentially turn into tendons. So they become, again, these really dense collagenous tissues that have very little innervation or blood supply. And these are a little different than ligaments because there's some elastin in them, what makes them a little bit more elastic than the ligament, because we do want to have a little bit of motion, right, in our tendons, because the motions are the attachment, the tendons are the attachment point for how our muscles begin to move the bone. So the function of the tendon is to connect the muscle to the bone, providing stability and movement. And again, tendons are not meant to be stretched. So the one that most people, it's easy to identify and to look at, is the hamstring tendon. Now, the hamstring, what we'll learn about the hamstring later on in our muscular section, but there's 3 different hamstrings. And essentially what happens is, I'm going to just pull this up here, is the muscles, you can see here, we'll just take this muscle and look at the muscle here. So this is one muscle, this is a second muscle, and this is a third muscle here. And you can see the red belly, the red portion, this is the skeletal muscle. This is the actual muscle, the belly of the muscle. And then you'll notice that it starts to turn into this white color. And if I highlight this, it'll turn it yellow. So you can see here, this is this orange, and then yellow is the tendon of the muscle, and it is the place where the bones insert and attach. Sorry, it's where the muscle inserts and then attaches on bones. And this is a really great example because it's so big. And now, again, there's 3 separate tendons here, but sometimes when we talk about, so there's 3 separate ones here, and then you can see down here as we come down that there is an attachment site here. This is called the sit bones, and we'll give you the actual name of that bone when we look at the bone in the next couple of videos. But the origin is up here, and then it comes down, the muscle comes down and attaches down at these different areas of the knee. So you can see here's, if we follow this one, we can probably highlight it. And you can see here, it attaches right here at the top of the tibia. This one here attaches a little bit more anteriorly on the tibia. And then this one over here, there's actually 2 heads, 2 different heads of the muscle here. You can kind of see if we click on this one. Oh, it might not highlight it for us. Oh, there we go. Good. So this is called the biceps femoris tendon, and you'll learn how that relates to this muscle here, but it connects, you can see here on the fibula. And, I picked this muscle to use as an example of tendons. Now, all the muscles will have tendons. So you'll see as we go through, you'll see when we look at the muscles, you'll see this exact same shape. You'll see the red belly of the muscle, and then you'll see the upper portion and the lower portion, that's the tendon. But I wanted us to just take a moment here and look at this from a yogic perspective, because this is a really, this place is often a place of injury for people. They can get hamstring tendonitis or tendinopathy. And we're gonna just go back here, and I'm gonna make this a little bit bigger for you because it's a little easier sometimes to see in the illustration. Good. So right here, where those where the tendons come together, it can often be an area that is injured in our yoga practice from the extensive forward folding and then stretching from standing and also from sitting. And one of the concepts I just wanted to briefly touch on here, because you're going to get them in other sections from other teachers, but this particular muscle, we need to really be conscientious of this tendon. We really need to be conscientious of it. So one of the things I want to point out is this concept of ahimsa. So you'll learn the yamas and the niyamas, and ahimsa is one of those principles, and it's the principle of non-violence. So not being violent towards others and actually towards yourselves. So being aware of how, when we talk about practice, when inside of asana, how we can be non-violent to our body. And this is such a great example of that. So a lot of us want to be able to stretch and touch our hands to the floor or touch our toes, or when we're in our seated forward fold, we really want to be able to reach the toes in front of us. And what we can sometimes do is go beyond that, the actual ability of the stretch of the muscle, and we can create irritation or a tear in that tendon. And then the other concept I just want to bring in here too, when we talk about this, is abhyasa and variaga. And you have to excuse me, my Sanskrit on that second word is not awesome. But essentially what they mean is persistent effort and non-attachment. So Yoga Sutra 1.12 says abhyasa variaga bhayam tanidroda, which is practice and detachment are the means to still the movement of consciousness. So we want people to be able to maintain a disciplined practice while also remaining unattached to a particular outcome. So in reference to our hamstring and our hamstring tendon, what we really are wanting to be aware of is just like, where is our body at right now, and what feels good and right in the body versus what I think I need to be doing, what I think it needs to look like, or what I want it to look like, and I'm going to push beyond those means. So those three concepts sort of, we kind of touch on them here and they fold in a little bit, and we'll probably revisit them as we go through the next few video modules, as well as when we'll talk about them when we are in our practical application in our live classes. So that's it. We'll just real quick review. So ligaments are connect bone to bone. They're not meant to be stretched, very little innervation or blood supply. Most common ones are seen in the knee and in the sacrum. And then tendons connect muscles to bone. Again, same thing, very little innervation, very little blood supply, a little bit stretchier than the ligaments because of the motion that they're doing, but still necessary, still not meant to be overly stretched. So that ends this portion. In the next video, we will check out fascia.